Have you ever wondered if something as simple as eating one egg a day could dramatically improve your health as you age? What if I told you that doctors have discovered that just one daily egg can strengthen your muscles, protect your heart, sharpen your mind, and even fortify your bones? But here's something most people don't realize. Not all eggs are created equal. Some eggs can do more harm than good, especially for seniors over 60. Eating the wrong kind could silently be putting your health at risk without you even realizing it. In today's video, we'll uncover the incredible health benefits of eating eggs daily, and more importantly, the 5 types of eggs you must avoid to protect your well-being. Stay with me until the end because the choices you make about your diet today can shape the quality of your life tomorrow. Before we begin, if you find this kind of health advice valuable, consider subscribing and turning on notifications so you never miss an important update. Now, let's get started. As we get older, our bodies go through many changes. Our muscles weaken, our bones lose strength, and our memory isn't as sharp as it used to be. But the good news is the right foods can slow this process down, and eggs happen to be one of the most powerful superfoods for older adults. Eggs are packed with essential nutrients, high-quality protein, vitamin D, choline, and omega-3 fatty acids, all which help maintain muscle mass, brain health, and heart function. However, not all eggs are good for you. Some eggs can carry harmful bacteria, increase cholesterol problems, or even expose you to toxic substances. So while one egg a day can be beneficial, eating the wrong kind could be doing the exact opposite. Let's start with the 4 biggest benefits of eating eggs daily before we reveal the 5 eggs to avoid at all costs. First benefit: stronger muscles. Stay active and independent. One of the biggest challenges of aging is the gradual loss of muscle mass. You might have noticed that climbing stairs feels harder, standing up from a chair takes more effort, or carrying groceries isn't as easy as it used to be. This condition, called sarcopenia, is a major reason older adults experience falls and fractures. But here's the good news. A single egg a day can help slow this process down. Eggs are packed with high-quality protein, providing all 9 essential amino acids that your body needs to build and repair muscle tissue. A study from the American Journal of Clinical Nutrition found that older adults who consumed enough protein, especially complete proteins like eggs, experience slower muscle loss and greater strength over time. I once had a 65-year-old patient who struggled with back pain and leg weakness. He assumed that resting more would help, but it actually made things worse. His muscles became so weak that he needed assistance to walk. I encouraged him to add 1 egg a day to his diet, along with other high-protein foods. Within a few months, his strength improved, his mobility increased, and he regained his confidence. Takeaway: if you want to stay active, independent, and strong as you age, make sure you're getting enough protein daily. And adding an egg a day is one of the simplest ways to do it. Now, while eggs can strengthen your muscles, they also play a major role in keeping your brain sharp. Do you ever walk into a room and forget why you're there? Or struggle to remember names and dates? Second benefit: a sharper mind. Keep your memory strong. Have you ever walked into a room and forgotten why you were there? Or struggled to remember names, dates, or even important daily tasks? At first, it seems like a small inconvenience, but over time, these moments of forgetfulness can become frustrating and even concerning. You may find yourself misplacing items more often, losing track of conversations, or forgetting familiar faces. While occasional forgetfulness is normal, frequent memory lapses can be an early sign of cognitive decline, which affects millions of seniors worldwide. The good news is that the right nutrition can help slow this process and keep your mind sharp. One of the most powerful brain-boosting foods is the egg. Eggs contain a vital nutrient called choline, which plays a crucial role in brain function. Choline helps produce acetylcholine, a neurotransmitter responsible for memory, learning, and cognitive processing. When the brain lacks enough choline, neurons struggle to communicate effectively, leading to slower thinking and memory problems. Research from Harvard's T.H. Chan School of Public Health has shown that people who consume enough choline perform better on memory tests and have a lower risk of developing cognitive decline. Another study published in the journal Nutrients found that older adults who eat eggs regularly tend to have better cognitive function compared to those who don't. But the benefits of eggs go beyond choline. They also contain omega-3 fatty acids, which help reduce inflammation in the brain and protect against neurodegenerative diseases like Alzheimer's. Additionally, eggs provide antioxidants like lutein and zeaxanthin, which help shield brain cells from damage over time. I once had a patient named George, a 77-year-old man who had been struggling with memory loss. His wife brought him in, worried about his increasing forgetfulness. He often forgot to take his medications, misplaced important documents, and even had trouble recognizing family members at times. After reviewing his diet, I noticed that he wasn't getting enough choline or omega-3s, both of which are essential for brain function. I advised him to start eating 1 egg a day, along with other brain-healthy foods. Within a few months, his wife noticed remarkable improvements. He was more engaged in conversations, remembered to take his medications on time, and even started recalling childhood stories he hadn't talked about in years. His transformation was incredible, and his confidence in daily life returned. If you want to protect your brain, boost your memory, and reduce the risk of cognitive decline, don't overlook the power of eggs. Adding just 1 egg a day to your diet can provide the essential nutrients your brain needs to stay healthy and sharp as you age. Third benefit, a healthier heart. The truth about cholesterol. For decades, eggs were blamed for high cholesterol and heart disease. Many people were told to avoid them completely, believing they would clog arteries and increase the risk of heart attacks. Doctors used to warn patients that consuming eggs could raise their cholesterol and lead to cardiovascular problems. Because of this, many seniors cut eggs out of their diet entirely. But modern research tells a very different story. Scientists now know that eating eggs in moderation does not significantly raise bad cholesterol levels for most people. In fact, eggs can actually be beneficial for heart health. Eggs help increase HDL, also known as good cholesterol. HDL cholesterol helps remove excess cholesterol from the bloodstream, preventing plaque buildup in the arteries. This reduces the risk of heart disease and stroke. Additionally, eggs contain omega-3 fatty acids, which help lower inflammation, support blood circulation, and improve overall heart function. They're also rich in essential vitamins like B6, B12, and folate, all of which play a crucial role in maintaining cardiovascular health. A study published in the Journal of the American Medical Association found that people who eat eggs regularly have a lower risk of cardiovascular disease compared to those who avoid them. Another study from the American Journal of Clinical Nutrition showed that moderate egg consumption does not increase the risk of heart disease, even for individuals with high cholesterol. Many people don't realize that dietary cholesterol, the cholesterol found in food, has little impact on blood cholesterol levels for most individuals. Your liver naturally produces cholesterol, and when you eat cholesterol-rich foods like eggs, your body compensates by producing less. This means that eating eggs won't necessarily raise your cholesterol the way many once believed. I had a 66-year-old patient named Robert who had been avoiding eggs for years because of his high cholesterol. He believed that even a single egg could make his condition worse. He had completely eliminated egg yolks from his diet, eating only egg whites. He was frustrated, constantly worried about his cholesterol levels, and unsure what foods were safe to eat. After reviewing his overall diet, I explained that moderate egg consumption is not harmful and, in fact, could benefit his heart health. I encourage him to start eating 1 whole egg per day, along with other heart-friendly foods like leafy greens, nuts, and healthy fats. Within a few months, his cholesterol levels remained stable. His doctor noted improvements in his heart health markers, and he felt more energetic. His biggest regret was that he had avoided eggs for so many years based on outdated information. If you've been avoiding eggs because of old cholesterol myths, it's time to rethink that decision. When eaten in moderation, eggs can be a heart-healthy addition to your diet. They provide essential nutrients that help maintain good cholesterol levels, reduce inflammation, and lower your risk of heart disease. Fourth benefit, stronger bones, prevent fractures and osteoporosis. As we get older, One of the biggest health risks we face is osteoporosis, a condition that weakens bones, making them more fragile and prone to fractures. Many seniors don't realize they have osteoporosis until it's too late, often discovering it after suffering a hip fracture or other serious injury. The truth is, our bones naturally lose density with age, but the right nutrients can help slow this process and keep our bones strong. Eggs contain two key nutrients that are essential for bone health: vitamin D and calcium. Vitamin D plays a critical role in helping the body absorb calcium efficiently. Without enough vitamin D, even a calcium-rich diet won't be fully effective in maintaining bone strength. Unfortunately, many older adults don't get enough vitamin D, especially those who spend less time outdoors. Since eggs are one of the few natural food sources of vitamin D, eating them daily can help fill this gap. Calcium is another crucial nutrient for bone health. It helps maintain bone density and strength, reducing the risk of fractures. While dairy products are often the first thing that comes to mind for calcium, eggs also provide a significant amount of this essential mineral. When combined with vitamin D, the calcium in eggs becomes even more beneficial, helping to protect against osteoporosis. A study published in the Journal of Bone and Mineral Research found that older adults with sufficient vitamin D levels had a significantly lower risk of fractures compared to those who were deficient. Another study in the American Journal of Clinical Nutrition showed that seniors who regularly consumed vitamin D-rich foods had stronger bones and a reduced risk of falls. I once worked with an 80-year-old woman named Margaret who had suffered a hip fracture due to osteoporosis. Before her injury, she had no idea that her bones were so weak. After her surgery, her doctor recommended physical therapy, but she struggled with pain and slow recovery. In addition to her treatment, I advise her to increase her intake of vitamin D and calcium by incorporating an egg a day into her diet. Over the next few months, her bone density improved, and she regained her mobility faster than expected. She was amazed at how such a simple change made a significant difference in her recovery. If you want to protect your bones, reduce your risk of fractures, and stay mobile as you age, ensuring that you get enough vitamin D and calcium is essential. Eggs are an easy and delicious way to add these vital nutrients to your diet. They can support bone strength, improve balance, and help you maintain an active, independent lifestyle well into your later years. In the next section, we'll go through the 5 types of eggs you should never eat to protect your health. Some of these may be sitting in your fridge right now, without you realizing the risks they pose. Stay with me, because avoiding these dangerous eggs could help prevent serious health complications. Number 1, cracked eggs. Have you ever picked up an egg from the carton and noticed a small crack on the shell? Maybe you thought, it's just a tiny crack. I'll use it quickly and it should be fine. But here's the truth. A cracked egg is a ticking time bomb for food poisoning. Eggshells serve as a natural barrier, protecting the egg from harmful bacteria. But once that shell is cracked, even if the membrane inside appears intact, bacteria like Salmonella and E. coli can easily enter. These bacteria thrive in the moist environment inside the egg, multiplying rapidly even when the egg is stored in the refrigerator. For younger people with strong immune systems, consuming a cracked egg might not cause immediate harm. But for older adults whose immune defenses naturally weaken with age, foodborne illnesses from contaminated eggs can lead to severe digestive issues, prolonged sickness, and even hospitalization. Common risks of eating a cracked egg include salmonella infection, which can cause nausea, vomiting, diarrhea, fever, and dehydration. E. coli contamination is another concern, as it can lead to severe stomach cramps, kidney problems, and in rare cases, life-threatening infections. Since seniors often have a weakened immune response, their bodies may struggle to fight off these bacterial infections, leading to longer recovery times and serious complications. To avoid these risks, always inspect eggs before buying them. Check the carton carefully for any cracks before placing it in your shopping cart. When you get home, handle eggs gently to prevent accidental cracking, and store them properly in their original carton in the refrigerator at 40 degrees Fahrenheit, 4 degrees Celsius, or lower to slow bacterial growth. If you ever find a cracked egg in your fridge, don't take the risk. Discard it immediately instead of trying to cook or salvage it. Many people don't realize how dangerous cracked eggs can be. But now that you know, you can make safer choices for yourself and your loved ones. When in doubt, throw it out. Number 2, undercooked or soft-boiled EGS. Many people love soft-boiled eggs with their delicious runny yolks, believing they are more nutritious and flavorful than fully cooked eggs. There's something satisfying about dipping toast into a warm, golden yolk. But while soft-boiled or undercooked eggs may taste great, they come with a serious health risk, especially for seniors. When eggs aren't cooked at a high enough temperature, dangerous bacteria like Salmonella can survive. This means that even though the egg looks fresh and safe to eat, it may still carry harmful pathogens that can cause food poisoning. Salmonella infection can lead to nausea, vomiting, diarrhea, fever, and dehydration, symptoms that can be mild for younger adults but far more severe for older individuals. Seniors, especially those with weaker immune systems, are at a higher risk of complications from foodborne illnesses. Even a mild case of food poisoning can result in severe dehydration, hospitalization, and long-term health issues. Some people assume that as long as the eggshell is clean and unbroken, the egg inside must be safe. But here's what many don't realize. Contamination can occur inside the egg before the shell even forms. If a hen carries Salmonella, the bacteria can infect the egg while it's still developing, making it impossible to detect from the outside. This is why even eggs that look perfectly normal can pose a risk if they are undercooked. To ensure safety, eggs should always be cooked to at least 160 degrees Fahrenheit 71 degrees Celsius. This temperature is high enough to kill any harmful bacteria, making the egg completely safe to eat. If you enjoy soft-boiled eggs, consider using pasteurized eggs, which have been treated to kill bacteria while maintaining their texture. A safer alternative is to fully cook your eggs while still keeping them soft and enjoyable. Scrambled eggs, hard-boiled eggs, and poached eggs cooked until the whites and yolks are firm are all excellent choices. By making this small change in how you prepare your eggs, you can enjoy all the benefits without the risks. Number 3, Century EGS. Century eggs, also known as preserved eggs or thousand-year-old eggs, are a delicacy in some Asian cuisines. These eggs undergo a preservation process where they are soaked in a mixture of clay, ash, salt, and alkaline substances for several weeks or months. The result is an egg with a dark, jelly-like texture and a strong, pungent flavor. While some people enjoy their unique taste, Century eggs come with significant health concerns, especially for seniors. One of the biggest dangers of Century eggs is their extremely high sodium content. Because salt is used heavily in the preservation process, these eggs contain far more sodium than fresh eggs. Excess sodium intake is a major risk factor for high blood pressure, heart disease, kidney problems, and stroke, all of which are particularly dangerous for older adults. If you already have hypertension or cardiovascular conditions, regularly consuming Century eggs could make these conditions worse. High sodium levels can cause water retention, swelling, and increased strain on the heart, leading to serious health complications over time. Another concern is the possibility of heavy metal contamination. Some traditional methods of preserving Century eggs involve the use of lead oxide, which helps speed up the curing process. While modern versions are labeled as lead-free, studies have found that trace amounts of heavy metals like lead and cadmium can still be present. Long-term exposure to these substances has been linked to brain and kidney damage, making Century eggs a potential health hazard for seniors. If you enjoy Century eggs, it's best to consume them only occasionally and in moderation. Always check the label to ensure they are certified lead-free, and avoid them if you have high blood pressure or kidney issues. Sticking to fresh, well-cooked eggs will provide all the nutrients without the added risks. Number 4, deep-fried EGS. Deep-fried eggs, sometimes called tiger skin eggs, are popular in certain cuisines because of their crispy texture and rich flavor. These eggs are typically fried at extremely high temperatures, giving them a golden brown, crunchy exterior. While they may be delicious, they pose serious health risks, particularly for older adults. One of the biggest concerns with deep-fried eggs is the formation of harmful chemical compounds during the frying process. When eggs are cooked in very hot oil, They can produce benzopyrene and heterocyclic amines, HCAs, both of which have been linked to increased cancer risk, heart disease, and chronic inflammation. Deep frying also requires a large amount of unhealthy oils, many of which are high in trans fats and saturated fats. These fats are known to raise LDL, bad cholesterol, clog arteries, and increase the risk of heart attacks and strokes. For older adults who are already more vulnerable to cardiovascular disease, consuming deep-fried foods regularly can accelerate these serious health problems. Another issue is the high calorie content. Deep frying dramatically increases the number of calories in an egg, contributing to weight gain, high blood pressure, and insulin resistance, all of which are linked to diabetes and metabolic disorders. To protect your health, it's best to avoid deep-fried eggs and opt for healthier cooking methods. Instead of frying, try boiling, poaching, scrambling, or baking your eggs with minimal oil. These methods retain the egg's nutrients while eliminating harmful toxins and excess fats. If you still crave a crispy texture, consider using an air fryer, which requires little to no oil and is a much healthier alternative. Deep-fried eggs may taste great, but the damage they can do to your body is simply not worth the risk. Making smarter food choices today can help you live a longer, healthier life. Number 5. Fertilized EGS. Fertilized eggs, such as Ballot, are considered a delicacy in some Southeast Asian countries. These eggs contain a partially developed duck or chicken embryo, giving them a unique texture and flavor. Some believe they are highly nutritious, but for seniors, fertilized eggs come with significant health risks that are often overlooked. One of the biggest concerns with fertilized eggs is their high risk of bacterial contamination. Because these eggs are incubated in warm, humid conditions for days or even weeks, they create an ideal environment for harmful bacteria like Salmonella and E. coli to thrive. If not properly handled or cooked, Ballot can cause severe food poisoning, leading to nausea, vomiting, diarrhea, fever, and dehydration. For seniors, whose immune systems are naturally weaker, even mild foodborne illness can result in serious complications and hospitalization. Another issue is digestibility. Unlike regular eggs, Ballot contains bones, cartilage, and partially formed tissues, which can be difficult for the stomach to process. For older adults whose digestive systems may not be as strong as they once were, eating Ballot can cause bloating, stomach discomfort, and indigestion. Ballot is also high in cholesterol and fat, which may not be suitable for seniors with heart disease, high blood pressure, or high cholesterol levels. While eggs in general contain cholesterol, the additional fats and organ tissues in Ballot can contribute to artery blockage and increase cardiovascular risks, especially if consumed frequently. To stay safe and maintain good health, it's best to avoid fertilized eggs like Ballot and stick to regular fresh eggs, which offer all the essential nutrients without the risks. If you're looking for a high-protein, nutrient-dense food, well-cooked eggs are a far better and safer option. Now that we discussed which types of eggs to avoid, let's focus on the best and safest ways to cook eggs to maximize their health benefits while keeping them easy to digest. Cooking eggs properly kills harmful bacteria while preserving their rich nutrients, making them a perfect addition to a balanced diet for seniors. Hard-boiled eggs, a simple and nutritious snack. Hard-boiled eggs are one of the healthiest ways to eat eggs because they are fully cooked, eliminating any risk of bacterial contamination. They are also easy to digest, making them a great choice for seniors. To prepare, place eggs in a pot and cover them with water. Bring the water to a boil, then reduce the heat and let them simmer for 10 to 12 minutes. Once done, remove the eggs and place them in cold water to cool before peeling. They can be enjoyed as a snack, in salads, or with a sprinkle of salt and pepper. Pro tip: adding a splash of vinegar to the boiling water can make peeling easier. Scrambled eggs with vegetables, a soft and flavorful breakfast. Scrambled eggs are soft, easy to chew, and gentle on the digestive system. Plus, they can be customized with healthy vegetables for extra fiber and nutrients. To make, beat 2 eggs in a bowl and add a splash of milk for extra creaminess. Heat a small amount of olive oil or butter in a non-stick pan over low heat. Add chopped vegetables like spinach, tomatoes, or bell peppers for added vitamins. Pour the eggs into the pan and stir gently with a spatula until cooked through. Season with a pinch of salt and black pepper for flavor. Pro tip: cooking on low heat helps retain nutrients and prevents overcooking. Poached eggs, soft and easy to digest. Poaching is a gentle cooking method that keeps the egg soft, easy to chew, and full of nutrients without using excess oil or butter. To make, bring a pot of water to a gentle simmer, not a rolling boil. Add 1 teaspoon of vinegar to help the egg whites stay together. Crack an egg into a small bowl, then gently slide it into the water. Let it cook for 3 to 4 minutes. Then remove with a slotted spoon. Enjoy poached eggs over whole grain toast or with avocado for a nutritious meal. Pro tip: poached eggs are perfect for people with digestive issues, as they are soft and light on the stomach. Baked eggs with cheese, a no-fuss meal for any time of day. Baking eggs allows for slow cooking, which helps retain nutrients while creating a rich, satisfying meal. To make, preheat your oven to 375 degrees Fahrenheit, 190 degrees Celsius. Grease a small baking dish with olive oil or butter. Crack 2 eggs into the dish and add grated cheese, herbs, or diced tomatoes. Bake for 12 to 15 minutes until the whites are fully set. Serve with whole grain toast or a side of fresh salad. Pro tip: baking eggs in small ramekins makes them easy to serve in portions. Egg salad, a heart-healthy, protein-packed lunch. Egg salad is a soft-texture, high-protein meal that is easy to eat and can be made healthier by using Greek yogurt instead of mayonnaise. To prepare, hard-boil 4 eggs, then chop them into small pieces. Mix with 1 tablespoon of Greek yogurt or light mayo. Add chopped celery, green onions, and a pinch of salt and pepper. Serve on whole grain bread in a lettuce wrap or as a side dish. Pro tip: add a squeeze of lemon juice for extra freshness. Now, I'd love to hear from you. Will you start eating eggs daily for better health? Which tip from today's video will you apply to your routine? Leave a comment below and share your thoughts. If you found this video helpful, hit the like button and share it with a friend or family member. And don't forget to subscribe so you never miss a health tip that could change your life. Let's take care of our bodies, make smart food choices, and live a healthier, happier life, one egg at a time.